I'm Henry Beeman Othersen, Jr., graduated from medical school in 1953 and joined the Charleston County Medical Society almost immediately because I felt that it was a good way to have a connection between town and gown. It was a good way to bridge the gap. I was a specialist in pediatric surgery, which is very specialized, and so I needed to know everybody in town, the pediatricians particularly, but also all the other surgeons. I became the Secretary-Treasurer of the County Medical Society in 1969. I thought it was important to keep the finger on the pulse of the medicine in Charleston, and then I became president. There still is a need for good communication. Medicine has changed a lot, and most people, when they go out into practice now, most physicians, young physicians, employed by a hospital system somewhere. And when I was coming along, everybody was in private practice. So it's important that we be able to talk to each other. And sometimes if there's no communication, a patient is referred elsewhere when he could be, or he or she could be referred within the system here because everything is available like that. The availability of mentors in the County Medical Society, I think it's important because my communication with them and working with them in the County Medical Society made it on a different level. It made it more personal to me. It's worth it to be able to have someone to bounce things off of. I think that the Charleston County Medical Society serves as a melting pot, sort of like for physicians in Charleston. They can get together, they know each other, they call each other by their first names. They're not enemies simply because they're in competing systems. The physicians themselves want to give the very best care to their patients. And there's no question that communication among everybody is important for the patient. And patients often can be referred to somebody in the system somewhere here in the Charleston area without having to go anywhere else. So I think it does improve medical care to patients. And it also makes it more enjoyable to each other. You're not fighting to get the patients in your system rather than in some other system. You try to work so that the center of focus is the patient, and you get the patients to have the very best care that can be offered in the community. But right now, I'm down from being totally involved in medicine like I used to be. I was the only pediatric surgeon here for 14 years, and so I was on call 24/7. And I enjoyed it. It wasn't work to me. And the simple thing of joining a group that is concerned not just with your personal practice, but with all of medicine in this Charleston community and the state, all medicine in the state. And those things, by working together, can't do anything to harm patients. They will help.